Well, welcome back to Nichols 2 Cents. I know it's been a while. Just trying to get things together for my kids for the end of summer. I'm sure a lot of parents are going through that right now as well. But I wanted to talk today about neurodegenerative diseases because I've seen an increase, I guess, in diagnoses in regards to some of the patients that seek out my care. So recently I had a new patient come in who's 52 and was diagnosed with early onset Alzheimer's disease. And 52 is very young. And anyways, to make a long story short, his wife noticed that, he wasn't as sharp and she thought that he was ignoring her, and essentially he didn't really understand or hear that she was talking to him or comprehend that, and he wasn't as sharp on tasks and things that way. And I mean, who would think a 52-year-old would have Alzheimer's disease? Well, at the end of the day, any type of neurodegenerative disease is dealing with dysfunctions in neurotransmitter signaling or pathways. And so, looking at Alzheimer's, Parkinson's, we're looking at the cholinergic pathways and the dopaminergic pathways. And when you look at treatment for Parkinson's disease, medications that are given for that, Alzheimer's disease, medications that are given for that are called anticholinergics. So essentially what they do is they decrease the breakdown of acetylcholine. Acetylcholine is a fat that is important for membrane fluidity, important for brain function, and essentially this is a supplement. So phosphatidylcholine you can get in certain foods, like eggs are high in choline, and what it does is it helps with brain health. As we get older and the body starts breaking down choline, that's what can cause a deficiency in choline, and that's what can cause symptoms of Alzheimer's, and that's why the medications work on decreasing the breakdown of acetylcholine. You can take the supplement choline, and that does help with neurodegenerative disease. It also does help with brain fog and memory and focus concentration. So, if you are having problems like that, not only looking at a ketogenic diet, increasing fat intake, but then looking at taking a supplement of choline, that can definitely help. And that can also help if you are diagnosed with, Alzheimer's or neurodegenerative disease, to help increase what you have from a choline standpoint. And, hopefully that will ward off symptoms that might be going on longer. So, talking about neurodegenerative disease today, it's a scary thing. It can definitely be a sad thing for loved ones, but let's focus on prevention. And, when you're having some issues like brain fog and, things like that, don't think about, oh my gosh, do I have dementia? Think about a choline deficiency. All right, hopefully we will be in touch a little more frequently this time. If you guys have any topics or anything that you want questions on, message us on Facebook and we will get back to you. All right, thanks.